Metastatic castration-resistant prostate cancer remains a major clinical challenge despite recent therapeutic advancements. Treatment intensification strategies combining androgen receptor pathway inhibitors with novel agents aim to improve outcomes. This review analyzes recent clinical trials and explores future directions in optimizing sequencing and overcoming resistance. Recent trials have evaluated combination therapies to improve outcomes, such as PARP inhibitors with ARPs in the TALAPRO-2 trial combining enzalutamide with talazoparib, which improved radiographic progression-free survival in the overall population with an HR of 0.63 and with a more pronounced benefit in HRR-positive patients. Another example is radioligand therapy, such as in the VISION trial where lutetium PSMA is combined with standard of care and resulted in improved rPFS and overall survival, showing promise in PSMA-positive patients. On the other hand, the future of metastatic castration-resistant prostate cancer treatment focuses on approaches such as improving combination approaches, such as the LuPARP trial, which is assessing combination of olaparib with lutetium PSMA in RP pre-treated patients, while the PEACE-3 trial investigates radium-223 combined with enzalutamide for bone-only metastases. Secondly, another approach is to attempt to counter androgen receptor resistance, such as the recent trial which evaluates the androgen receptor degrader IARV766 combined with abiraterone to improve responsive in AR mutant patients. In particular, radiographic progression-free survival in patients with PTEN loss and those with other mutations showed a particular benefit over the unselected population. To conclude, treatment intensification strategies in mCRPC have demonstrated improvements in radiographic progression-free survival, but the lack of mature overall survival data in some trials remains a concern. Novel combinations show great promise in biomarker-selected populations, reinforcing the need for genomic profiling in routine clinical practice. Another key limitation across these trials is that most patients have progressed on traditional ADT with or without docetaxel, while data on RP pretreated mCRPC remain limited, which is increasingly seen in practice. Future research should prioritize optimizing treatment sequencing, addressing resistant mechanisms, and evaluating the effectiveness of these therapies in RP pretreated patients to achieve better outcomes for patients with mCRPC.